Most men don't notice this until it's too late. That's the hard truth about prostate health. For many men over 60, the subtle signals have been whispering for years. Late-night bathroom trips, a slower stream, a lingering feeling of not being quite empty. But these signs often get brushed aside, chalked up to age or stress, or just one of those things. Until one day, they can't be ignored any longer. Until it's no longer just an inconvenience, but a warning. So let's ask the question many are too embarrassed to say out loud. What if your body is trying to tell you something important, and you're just not listening? If you're over 60, this could change how you see the next 10 years of your life. This isn't just about managing a health condition. It's about reclaiming your comfort, your dignity, and your peace of mind. Because what begins as a small disruption in your routine can quietly evolve into something much more serious. Today we're talking about prostate health, specifically enlarged prostate or benign prostatic hyperplasia, BPH, prostate cancer risks, and the frustrating cycle of frequent urination. By the end of this video, you'll know exactly what to watch for and how to respond with clarity, courage, and care. You'll understand what's normal, what's not, and how to have conversations that could change a life, maybe even save one. Let's begin with something you may already know, but might not fully understand. The prostate is a small gland, about the size of a walnut, located just below the bladder in men. It wraps around the urethra, the tube that carries urine from the bladder out through the penis. Its primary function is to produce seminal fluid, which nourishes and transports sperm. Seems simple enough, but here's where it gets complicated. As men age, the prostate tends to grow. That alone isn't necessarily dangerous, but the consequences can be deeply uncomfortable and disruptive. This non-cancerous enlargement is what we call BPH, benign prostatic hyperplasia. The word benign may sound reassuring, but anyone who has lived with BPH knows how much it can chip away at quality of life. It's not life-threatening, but it is life-altering. Imagine having to get up 2, 3, even 5 times a night just to urinate. That interrupted sleep builds into exhaustion. The constant awareness of a nearby restroom becomes a silent obsession. Trips are planned around bathroom availability. Social outings feel riskier. Long car rides become a challenge. It's like living under a quiet siege, and few people talk about it. The pressure BPH puts on the urethra narrows the passage through which urine flows, leading to symptoms like a weak stream, dribbling at the end of urination, the feeling that your bladder isn't completely empty, and that urgent, overwhelming need to go, sometimes with very little warning. For many men, it's an embarrassment they endure silently, even hiding it from their spouses or doctors. But here's the truth. BPH is incredibly common. By age 60, over half of men will experience some signs of it. By 85, that number jumps to 90%. So if you're dealing with these symptoms, you are not alone. And more importantly, you have options. Treatment for BPH ranges from lifestyle changes and medications to minimally invasive procedures. Sometimes it's as simple as reducing evening fluid intake, cutting back on caffeine or alcohol, or learning bladder training techniques. Other times, medications like alpha blockers or 5-alpha reductase inhibitors are prescribed to relax the muscles of the prostate and bladder or shrink the prostate over time. But sometimes lifestyle tweaks and medications aren't enough. In those cases, procedures like TURP, transurethral resection of the prostate, rhizome water vapor therapy, or UroLift may be recommended. These aren't the invasive surgeries of decades past. They're targeted, effective treatments that can significantly improve urinary flow and reduce symptoms. But before any of this can happen, the first step is admitting there's a problem. That's often the hardest part. Because here's the thing, the symptoms of BPH can mimic the early signs of prostate cancer. And that's where fear enters the equation. Some men would rather avoid the doctor entirely than face that possibility. The fear of cancer can silence even the most confident voices. But avoidance isn't protection, it's a delay. And with prostate cancer, early detection is everything. Prostate cancer is the second most common cancer among men, right after skin cancer. Most prostate cancers grow slowly, and when caught early, they can be treated successfully. But without screening, Those slow-growing cells can become silent killers. There's a reason we call it the silent disease. Often, there are no symptoms in the early stages. So, what should you look for? Changes in urination are a common early sign, yes, but so are blood in urine or semen, pain during ejaculation, erectile dysfunction, and pain or stiffness in the lower back, hips, or thighs. These aren't always cancer symptoms, but they're always worth discussing with a doctor. And this is where regular screening comes in. The PSA prostate-specific antigen blood test is one of the most widely used tools for early detection. It's not perfect. It can yield false positives or miss some cancers, but it remains a valuable indicator when combined with a digital rectal exam, DRE, and a patient's medical history. But there's one sign almost no one talks about, and it's the most important of all. It's the inner signal, the intuition, that little voice that says something feels off. It's easy to ignore that voice in the busyness of life, easy to explain it away. But that voice, that's often the first alarm bell. And here's where we pivot, because this conversation isn't just about illness. It's about empowerment. It's about recognizing what's happening in your body and taking the wheel before the road gets too rocky. It's about talking openly, without shame, about something that affects millions. Let's say this clearly. There is no shame in frequent urination. No shame in scheduling a PSA test. No shame in asking a urologist questions. What's shameful is a culture that teaches men to tough it out in silence. That's what we're dismantling here. That's what we're calling out. And if you've made it this far, I want to hear from you. Have you or someone you love dealt with frequent urination or prostate concerns? Leave a comment and let's break the silence. This is too important to keep bottled up. Now let's talk about the emotional toll. Because the physical symptoms are only half the story. The constant anxiety about leaking, the humiliation of adult incontinence pads, the fear of a prostate cancer diagnosis. These things weigh heavily. They erode confidence. They strain marriages. They isolate. Men often define themselves by strength and control. When your own body betrays you, it can feel like a loss of identity. That's why prostate issues aren't just urological. They're deeply personal. But here's the light in all of this. Things can get better. With the right treatment, men often regain control, confidence, and clarity. They sleep better. They travel freely. They engage socially again. They return to themselves. That's the promise of awareness and action. And let's not forget about caregivers. If you're watching this and caring for an aging husband, father, or friend, your role is vital. You are the observer, the advocate, the bridge between silence and support. You may be the one who notices subtle shifts, the longer bathroom visits, the increased irritability from lack of sleep, the withdrawal from activities once loved. Your voice matters. Your encouragement could be the reason someone finally sees a doctor. You're not just helping manage a medical issue. You're restoring dignity. And dignity matters, especially as we age. It's not just about longevity, it's about quality, about being able to move through the world without fear, without shame, and without the nagging ache that something's wrong, but you don't know what to do about it. Coming up, the one moment that still brings tears to my eyes. It was a man in his early 70s, a retired high school teacher. He came in with his wife, reluctantly. She was the one who insisted. He had been waking up 4 or 5 times a night, sometimes wetting the bed. He hadn't told her, but she noticed the sheets, the laundry changes. She loved him too much to let him continue suffering. He sat quietly as the doctor explained the tests. When the results came back, it was BPH, not cancer. They both cried, not because it was BPH, but because it wasn't cancer, because they didn't wait, because she spoke up. They treated it. Medication first, then a minor outpatient procedure. 2 months later, he took his grandkids to the zoo and didn't need to scout every restroom on the map. It was the first time in years he felt free. He said, "I didn't know how much it was weighing me down until it was gone." That story stays with me because it's not just about medicine. It's about love, about noticing, about not waiting too long. So here's the final word. If this reminded you of someone, share it with a friend. You never know who needs to hear it. Don't wait. Don't minimize the symptoms. Don't let fear rob you of the years ahead. We all age, but how we age is up to us. Leave a comment if you've seen this in your own family. We need to talk about this more. And follow at Aging Gracefully 60 for more conversations that matter.